Hi, my name's Mary Sabo, and I'm a physiotherapist at the Neo Kids Children's Treatment Center. Today, I'm going to be talking to you about taking care of your back. Over a long career, I've worked with a variety of persons with back care issues, old and young, and the back issues are occurring more and more in the younger population. I've been in pediatrics for over 20 years, so I'm aware of the environment in which you have to work in. My job is very physical, so I've tried to follow these principles that I'll be teaching you on a daily basis. Some days better than others. It's your back, so I want you to take care of it. Today, again, general principles will be talked about for everyday use, at work and at home. The accumulated wear and tear our bodies experience on a daily basis puts us at risk of experiencing pain, regardless of occupation. So I want to focus on MSD injuries, or musculoskeletal disorders, or what we call RSIs, repetitive strain injuries. The vernacular changes all the time. But that's what we want to focus on, non-specific back care injuries. Our audience tends to be daycare staff, whether a supervisor, whether an ECE, whether a kitchen staff, community partners, and allied health. So that's been the majority of people I've presented to in the past and currently, and that's where a lot of the feedback and moving forward with our problems that we'll present at the end have come from. So the objectives today, we'll be talking about general back facts, an overview of anatomy, load force, biomechanics, posture, and preventative strategies, tips and tricks. Some back facts. 20% of the population report chronic low back pain in 2010. We'll be using the acronym LBP for low back pain. The lifetime prevalence of low back pain is greater than 80%. The lower back is the most commonly affected as it bears the most weight and physical stress. And greater than 90% of low back pain patients referred to specialists are not surgical candidates. Low back pain affects 85% of the working population at some point in their lifetime. Low back pain is second only to the common cold as a cause of lost work time. Low back pain is second only to cardiovascular disease as a major cause of chronic health problems and long-term disability. And shockingly, low back pain direct or indirect cost is $1.2 billion per year in Ontario alone, and those are 2010 numbers. You'll see on the slide that we have a similar prevalence of low back pain for male and female. We are the red circle, the North America high income line, but you'll see although the numbers are somewhat different, there's pretty much the same trajectory between males and females. So if a patient suffers from back-dominant low back pain, which is manageable, no imaging is necessary. Concerned about your lumbar spine or low back with X-ray or MRI findings? Studies have shown that lumbar disc degeneration is present in 40% of individuals under the age of 30 and is present in over 90% of those between the ages of 50 to 55. Another study showed that amongst healthy young adults aged 20 to 22 years with no back pain, 48% had at least one degenerated disc and 25% had a bulging disc. Leading physicians at the Department of Neurosurgery at the University of California strongly recommend against the routine use of MRI for low back pain since they have found no link between degenerative changes seen on X-rays or MRIs and low back pain. Translation: don't panic if your X-ray or MRI shows problems with your discs. They're simply normal changes that happen from the age of 20 onwards. Standard teaching suggested that 80 to 90% of low back pain resolve in 6 weeks, independent of treatment. More recent epidemiological data suggests less optimistic results. A portion do not resolve spontaneously. Roughly 25% of individuals experience persistent and or episodic chronic low back pain, and those 25% go on to utilize 75% of the resources, including referrals, imaging, etc. In a Canadian population survey regarding low back pain, there's a higher likelihood of resolution in younger individuals. Most describe the pain as mild. Resolution occurs in approximately a third of the cases, with a third of those recurring, and persistent issues occur in approximately 40%. Low back pain is not a disease. Low back pain is a condition which we can manage, not necessarily cure, and is likely to recur. So today we want to focus on function. We have a knack for neglecting our backs. So after all the doom and gloom, what can we do? Well, prevention is key. Back care disorders can result from poor posture or awkward postures. I see everyone is sitting up a lot straighter now. Force. We will go into further detail on this topic. Repetition. I'll often reference frequency of flexion, as this is what most of us do all day long. Technology has invaded our lives, as have sitting postures. We are working at desks, driving in the car for various reasons throughout the day. Our cities spread out, as are a lot of them. We go home and do household chores. We have to do grocery. So there's many activities we do throughout the day that involve flexion. Another thing that causes back disorders is biomechanics. A fancy way of saying faulty body mechanics or improper lifting techniques. Muscle imbalances, poor muscle strength in the back and abdominal core musculature, lifestyle choices, including stressful living and work habits that occur in varying degrees for all of us. So let's start at the beginning with some basic anatomy. The spinal column is composed of 24 segments, stacked upon the other, and supported by various ligaments and muscles. So just to give you some orientation, this would be the front of the body, this would be the back of the body. And then you have skin and muscles and ligaments and tendons all involved here. So knowing that this is the front and this is the back, these are our cervical, our neck muscles. Then we have 12 thoracic, or sort of our mid-trunk vertebrae, and then 5 lumbar, so lower part of the spine, and then your sacrum and your coccyx. And the coccyx is that thing that you always, sometimes people injure when they're out tobogganing in our winters. The lumbar vertebrae, as you can see, are the largest and support the most amount of body weight. What I'll often reference, as well as low back pain, in this discussion is I'll often talk about the natural curves of the spine. So as you can see, the neck muscles tend to be, it's like an S. And this one's not quite the ideal because it's not a real life person. But you'll see a curve here. You want it curved out this way and curved in this way. And that's where optimally our body works the best. So vertebrae surround and protect the spinal cord. The back has 3 natural curves, as I've already mentioned. The cervical, thoracic, and lumbar. A healthy back is dependent on proper posture and a balance of these curves. Each vertebrae is composed of a body in the front that supports the weight of the spinal column of the vertebrae, as you can see on your slide, and 3 bony processes in the back for muscle attachment, and a lamina that joins them together. Between the vertebrae are discs that are designed not to slip or move around. That's a misnomer. Together, the intervertebral discs act as shock absorbers in our spine. The discs between the lumbar vertebrae must maintain their natural shape in order to support the force placed on them during activities throughout the day. The disc will support large amounts of force as long as the force or load is evenly distributed over the disc surface. The disc is divided into 2 different regions. The outer annulus fibrosus, which is more fibrous in nature, and the inner nucleus pulposa, and are all referred to that as disc nucleus. The nucleus is jelly-like and occupies the central part of the disc. The annulus is firm, like the outer dough of a jelly donut. The disc is jelly-like and capable of movement and is usually contained within itself. The nerves. The spinal cord travels behind the vertebral bodies. Spinal nerve branches off the spinal cord and travel through the intervertebral foramen and continue to further branch to all parts of the body. Also, the ligaments attach. So ligaments attach bone to bone, and whereas muscles just attach via tendons from bone to the muscle structure. And they complete the picture. Remember, discs are well hydrated. They're filled primarily with water, but as you age, the spine loses its flexibility. And the fact is, you shrink as you age. I haven't a hope in heck of being over 5 feet by the time I'm 70. Neat trick to do with kids, though, is because the disc is filled primarily with water. So measure kids first thing in the morning, and then at night you'll see they've shrunk just a little bit, and they'll think you're magic. So just to see here, these are the discs, and as you can see, they're much smaller in the upper part of the spine than they are in the lower part. So all that constant jarring we get throughout the day, that's when they're the shock absorbers. Your spinal cord, which takes the signals from your brain and delivers electrical signals to your muscles to work, they travel through. So they travel in between the vertebrae and the spinal processes. And they come down. And then the ones branching on the side here, those are your spinal nerves. So they come out, and so the ones at the upper part control the upper part of the body, and the ones towards the lower part of the body control the legs. What will happen, so if you can see here, it's a gross exaggeration on this model, but that will happen if you happen to get a disc herniation. So if it pops through, I mean, typically it would be more like the consistency of gum that you would find underneath the table. And it's really just the size of the tip of your pinky. So it's really, really small and not that large, but it can certainly wreak havoc, and we try to prevent any kind of disc herniation. Core muscles. The core refers to any muscle that attaches to the spinal column or the pelvis, which means that back pain can come from an imbalance or injury to any of these muscle groups. Core seems to be a buzzword recently, but physios were well ahead of the curve, as this has been part of our practice for many years. Back muscles. Back muscles are both short, they attach from one vertebrae to the next, and long, attach further up the spine. Together, they work to produce movement in a variety of directions and maintain proper posture and alignment. Back muscles are not designed for lifting. The work of lifting is accomplished using more powerful leg and gluteal muscles, or your butt muscles. Abdominal muscles. Abdominal muscles support the mid-trunk and protect the abdominal cavity. When contracted or tightened, abdominal muscles pull in at the sides and front, providing support. The lumbar spine is very mobile, or has lots of movement in it, and requires the additional muscular stability provided by the abdominal cavity and surrounding muscles. Strong back and abdominal muscles are necessary to support your spine properly. Supporting muscles. The upper trunk. The shoulder girdle is very mobile and must be supported by the muscles of the back and thorax, or your trunk. Elbows tucked in at the sides also serve as stabilizers for the upper trunk. Leg and gluteal muscles. They support the pelvis, promoting trunk stability and good posture. Load force. Load force is the pressure in the intervertebral disc in the standing position, which is considered the norm. Within the lumbar spine, different postures can increase pressure on the intervertebral disc. Different postures and activities have been studied to determine how they affect the load, particularly in the lumbar spine. The activities listed below have been found to increase the load force in the L3 intervertebral disc by the following amounts. Bending forward, 150%. Lifting a 20 kilogram weight with straight back and knees bent, 73%. As soon as you do the same activity with the knees straight, it increases to 169%. Coughing, sneezing, or straining, 5 to 35%. Laughing, by 40 to 50%. Although don't stop laughing, it's very important, but we have to be aware of how we're positioned while we're doing these things. Walking, 15%. Small jumps, 40%. And side bending, 25%. Disc pressure in the third lumbar disc during various activities. This is a standard by Jacobson. So as you can see, when we're lying supine, or that means on our back, our numbers are pretty low, 25. Again, this is just relative at this point. But as soon as you go to the right, into sideline, numbers creep up a little bit. You go up to standing upright, numbers go up even more. You bend over slightly, numbers go up more. Then you bend over slightly holding an object, huge jump. Come back down, we're sitting up straight. We sit slightly bent over in a chair, numbers go up again. And when you're sitting slouched in a chair, which I'm guessing the majority of us do throughout the day, the pressure is increased that much more. So here you can see the pressures when you're standing on the left and when you're sitting on the right. So they're just more increased when you're in sitting. But the more important thing to notice from this, looking at the force, is when you're holding, I mean, this is imperial numbers, but saying whether you're using metric or imperial, when you're holding 10 pounds towards your body, 10 pounds of weight is being distributed through the spine. If you're holding 10 pounds out with your arms extended, 100 pounds is being extended through the spine. The amount of force placed on your back under certain conditions can be surprising. Anytime you bend or lean over to pick up something, you put tremendous pressure on your back. To demonstrate this, think of your back as a lever. With this fulcrum in the center, how many pounds would it take to lift a 10-pound object? Anyone ever play on a teeter-totter? So if your brother was trying to prevent you from getting up, you had to be an equal weight to him. So if there's 10 pounds on one side of the teeter-totter, you need an equal 10 pounds on this side. When you add in the 105 pounds of the average human torso, and I'm only talking about the torso here, you see that lifting a 10-pound object actually puts 1,050 pounds of pressure on the lower back. And if you've happened to gain weight, the fulcrum has been moved. Repetition. The risk of developing a low back injury increases when the same parts of the body are used repeatedly, with few breaks or chance for rest. Highly repetitive tasks can lead to fatigue, tissue damage, pain, and discomfort. This can occur even if the level of force is low and the work postures are not very awkward. With repetitive tasks, it's not only important to consider how repetitive the task is, but also how long workers perform the task, the posture required, and the amount of force being used. Back problems are seldom the result of a single injury. Although this can happen in your home if you've ever worked with kids or in the work environment, you'll see those cars or a piece of Lego that you slip on when you're going down the stairs. The cumulative effect is what we're talking about, the straw that breaks the camel's back. A seemingly routine action causes an unpredictably large and sudden reaction. More than 70% of back problems begin during routine daily activities. Only about 30% are due to accidents and other forms of trauma. So it's more so due to improper lifting or faulty body mechanics. My favorite story is when I first started my professional life as a physiotherapist. I came in to get interviewed by my boss, and she dropped a pencil on the ground. So, being polite, I just went to pick it up. First, so I went to pick it up this way for her. And I handed it to her. She goes, "Stop right there." She goes, "You weren't even considering how you were lifting." She goes, "Back injuries cost us lots of money and lost time work injuries." And so she said, whether it's pencil or whether it's a patient, I want you to administer the same body mechanics throughout the day when you're at work. And I never forgot that lesson. And she also ended up being a great boss. Biomechanics is the science of movement of a living body, including how muscles, bones, tendons, and ligaments work together to produce movement. Rearrange the letters to spell out an important part of the human body, which is even more useful when erect. And spine is correct. Standing erect is the ideal anatomical position. The discs between the lumbar vertebrae must maintain their natural shape to support the force placed on them during various activities. Remember, the discs will support large amounts of force as long as the force or load is evenly distributed over the disc surface. The issue is, we don't stay in one position. So lumbar flexion, or forward bending. Increased lumbar spine flexion places increased load on the anterior portion of the disc, increasing the risk of pulling or straining the posterior aspect of the disc. So just letting you know, when I reference anterior, I mean near the front, and when I reference posterior, it means further the back in position. The nucleus is pushed towards the back. With sufficient or repeated stress, the nucleus may eventually push through the disc, resulting in a posterior disc herniation. Increased lumbar flexion stretches ligaments and muscles and reduces the effectiveness of lumbar muscles that maintain alignment. Anatomically, the ligaments at the back of the spine are not as strong as those on the front. Plus, we tend to perform the majority of our activities in flexion, as already mentioned. With prolonged stress and weakening, the back of the disc begins to fail, resulting in disc herniation or bulge. Here are a few analogies to help you choose to better relate. So I'm a foodie, so I reference sort of the nucleus as a jelly of the inside of the donut, and the donut being the outer dough ring. But if you love dental hygiene, think of it as the toothpaste in the tube and then the outer tube is the annulus. Or if you're into mechanics and you're a car mechanic, think of it as the inner tire tube and the outside as the tire. So to reiterate, the disc does not slip out of place. So what happens with repeated flexion? So we're forward bending, we're lifting, poor sitting and standing throughout the day. The disc bulges backwards. It presses on pain-sensitive ligaments and nerves, producing the pain that is felt in the low back. Often the disc bulges to one side, resulting in pain on that side. It can put pressure on a nerve in the spine and cause pain in your leg. Pain is therefore associated with a disc problem in your back, and there's nothing wrong with your leg. So often when I've seen people and they're telling me, their leg is so sore, and I start looking at their back, they're very confused about why I'm treating their back and not their leg. But as you can see, the nerves send the signals out to the leg. Lateral flexion or lateral bending is moving this way. This isn't a movement we typically do frequently throughout the day, but I just wanted to let you know that this is a movement to be aware of. Backward bending or lumbar extension. Excessive lumbar spine extension places increased load on the posterior portion of the disc, increasing the risk of pulling or straining the anterior aspect of the disc. This increased load also creates facet joint compression and irritation. The nucleus is pushed anteriorly or towards the front. With sufficient or repeated stress, the nucleus pulposa may eventually push through the disc, resulting in anterior disc herniation. Remember that anatomically there's a low probability of this occurring. The disc is bound too tightly by ligaments to slip towards the front. Also, less activities during our daily lives occur in repeated extension. So not too many of us are Michelangelo painting the Sistine Chapel. Resulting injuries from poor body mechanics. Whenever a force is applied to the spine that is out of neutral position, an injury can easily result. Increased flexion or bending or overextension, so bending backwards of the lumbar spine, increases the load forces on the anterior and posterior aspects of the intervertebral discs, increasing the risk of fiber tears or disc rupture or facet joint irritation or nerve pinching. Muscle strain can result from excessive muscle stretch during flexion and such activities such as bending from the waist. Posture. Posture is another name for the position of various parts of the body during any activity. For most joints, a good or neutral posture means that the joints are being used near the middle of the full range of motion. The further a joint moves towards either end of its range of motion, or the further away from the neutral posture, the more awkward or poor posture becomes, and the more strain is put on the muscles, tendons, and ligaments around the joint. For example, when the back is fully bent over, joints or certain parts of the spine are at the end of their range of motion. If the worker pulls or lifts repeatedly in this position, there is a higher risk of injury. With awkward posture, it is important to consider how long workers need to hold a specific posture, how many times an awkward posture is used in a given period of time, and the amount of force being exerted when an awkward posture is used. So this is our posture in standing. So this may be, the one in the middle, maybe us first thing in the morning, or if we're walking around the house with a book on our head. But I'm guessing it's typically the one of us on the left or the right. So either slouched forward or the one on the left, or the far one on the right is sort of a typical sway back. What we want to be aware of during the day is the plumb line. It's where our bodies work most efficiently. So it's a line drawn vertically. It should pass through the ear, the shoulder, the middle of the hip, the back of the kneecap, and the front of the ankle. You want to make sure your chin is not poking out, shoulders drooping, or slouching. You want to try to maintain, not exaggerate, the normal curves of the spine. Feet should be about hips width apart, knees slightly bent. If you have to stand for a long period of time, reduce muscle tension in your back by putting your foot up on a footstool, or the bottom of the counter, or a raised ledge, whatever you have available to you. Like I said, the posture on either ends is us completely slouched. And particularly the one on the right, if you've ever gone by any kind of bus stop in the morning, you see those typical lean, lanky teens at the bus stop, and all they're doing is hanging on their ligaments. There's no muscle work being activated there. Our bodies will take the path of least resistance. It just doesn't mean it's necessarily good for you. The only time a significant sway back is acceptable is when you're pregnant. But you'll notice if you ask anyone who is pregnant, they get accompanying discomfort with that. It's not expected that we will all walk around with a perfect posture. An office of our physiotherapist will quickly reveal that. But if we start with the ideal, so first thing in the morning, try to start nice and tall, and then we end up here, that's to be expected. But if we start off here, we ended off during the day really in poor posture and is more prone to injury. In sitting, we want to try to maintain the same curves of the spine as you have when standing. I'll always reference the S curves. Keep your knees level or slightly higher than your hips. You want to shift your sitting posture to decrease muscle fatigue during the day. Take advantage of a back in the chair to assist with posture, or add a lumbar roll or a rolled up sweatshirt. But ideally, if you're in the daycare environment, not all chairs have a back, but sometimes you just end up sitting in a kid's chair. The feet should lay flat on the floor, and if they don't, and some of you are vertically challenged like I am, you use a footrest. And you want to have your work properly located in front of you to reduce reaching strain on your back. With more and more of us doing more activity online, we want a proper ergonomic setup, a comfortable posture with everything within reach. We want to make sure our mouse is next to the keyboard at the same height. Good lighting. So don't be like my teenagers who are in their rooms in the dark, on their bed, sitting on their laptop all day long, doing work. Thighs should be parallel to the floor, hip and knees at 90-degree angles. The feet should lay flat on the floor or on a footrest. Ideally, if you have a height adjustable chair, do that so that it's below or at knee height. The back of the knee should be clear of the front edge of the seat. The back, including lower and mid back, should be well supported, and your forearms should be supported, and your shoulders should be relaxed at all times. Don't want to be holding yourself in this position all the time. You'll end up with all sorts of neck issues. Your elbows should be at approximately the same height as the keyboard. Your wrists should be straight at all times with your hands in line with your forearms. And then again, I know this is about back hair, this presentation, but this affects all sorts of issues with sort of carpal tunnel, and we're seeing all sorts of arm and hand injuries now with the move to online life. And the monitor should be at a comfortable reading distance and height. So believe it or not, we don't always we don't always have the ideal situation in life or in our work environments or in our home environments. So we have to make do in not so ideal situations. This is a situation at our previous offices, and so welcome to public health. There's no, we have one height adjustable standing desk here, but we still have some of the wooden desks. So we did what we could. We fixed this. So the picture on the left is how she was working initially, and she did have back pain. So we fixed this with a roll. We just took a lumbar roll, which we happen to have around because she works with physios, but you could have taken a rolled up sweatshirt and put it in the back. We couldn't do anything about the height of the desk, but we did. She had a height adjustable chair, so we did increase that. She had longer legs, so she did not need a footstool. Her feet were able to touch on the ground. And we moved her forward too so that she was supporting her forearms on the desk. And again, is it the complete ideal? No, but it was certainly better than what she was working in during the day. So now I want you all to get up and stretch. Just take up, stretch back, or walk around the room. And you'll often notice if you've ever driven anywhere, and when all of us used to drive and go places, that people automatically will get out of their cars, and first thing they do when they get out of their cars is they bend back. And they're not thinking, well, I have to maintain the natural curves of my spine. They're just doing it because it feels good. So again, I just strongly encourage you that if you have an opportunity throughout the day, set a timer, especially at your desk every 30 minutes or so, and just get up and stretch your back. It will feel really good. And also, if you have the option of a full back or rest or a lumbar, oftentimes they have a lumbar support integrated into them. But if not, we have to add that onto the seat, whether in the car or whether at your desk. You can use a rolled up sweater, or sometimes it's a full lumbar support. In the cars, we often have lumbar rolls built into cars. Again, I caution you. So one, if you need to change it prior to driving, change it before you drive, so you're not changing it while you're driving. But if you don't meet the industry specs, which is typically between around 5'4" to 5'10", a built-in lumbar roll may not hit you at the appropriate level in your back, so it's best is to add your own. Tips and tricks: sleep positioning. Lying on your side. You want to use a body pillow between your knees to keep your back from twisting while you sleep. If you're lying on your back, you want to place a pillow under your knees to take the pressure off your back while you're sleeping. You want to ensure that the pillow encapsulates the knee and the lower part of the leg. You don't want the ankles completely going down, if not you'll get more swelling throughout the night. Your mattress should be firm enough to support your spine in a neutral position. Now we're going to talk about log roll to get out of bed. So when you're getting out of bed, you want to roll over to your side and push yourself up using your arms to keep your back from twisting, and reverse it to get into bed. This is a good habit to get into, as opposed to forcing yourself up against gravity first thing in the morning. It's less force load and better body mechanics. And if you've ever had low back pain or abdominal surgery, you realize how much more efficient and less painful this way is. Prevention, tips and tricks to improve your posture. After all the doom and gloom, we want some good news. So we're going to show you how to keep your posture nice and healthy. Again, maintenance of that S-curve during all activities: walking, standing, sitting, bending, reaching, sleeping, lifting, etc. Again, the S-curve is that plumb, and we want that plumb line. So oftentimes we're all narcissistic, look at ourselves in the side with the mirror at the side, and that will kind of be a good visual cue for us throughout the day. Now we'll talk about tips and tricks for practicing proper lifting techniques. We want to maintain the same curves, back to the good old S-curves, of the spine that you have when you're standing. You want to make sure you have a firm hold on your object, and sometimes that's not so easy in the daycare. Kids can have slippery clothing, they can be wet, they can have sunscreen. You want to make sure your feet are shoulder width apart and can be slightly staggered. You want to squat with your knees going up and down and not bending at the hips. You want to face the direction you are lifting, using your feet to turn, not your back. No twisting. You want to engage your stomach and bum muscles to support your back, and you want to make sure you have supportive footwear that's non-slip. So what we're talking about, now you can just kind of do a couple things. I want you to stand right now and just, well, you know what, I'm going to put my spine down for a moment. I want you to stand still with your feet together, right, touching together. And I used to have people, if there's more than one of you in the audience, feel free to gently try to push each other over, okay? Or try to throw yourself off balance. Then what you want to do is put your feet a little bit wider apart, just wider than hips width apart. And now try to move yourself off balance, and you'll see it's a little bit harder. And if you stagger one foot slightly in front of the other, that's even harder to move you off balance. So that's where you're kind of safest and most optimal to kind of handle any of the forces that are being applied externally. If you look at, when we talk about twisting, how twisting is not beneficial, and we want to kind of turn our body towards the direction we're moving versus twisting. And the reason for that is, if you look up at the cervical spine or towards the neck muscles, okay, the way our spine works, or the joints up there that move the spine, because all movement occurs through joints, they're horizontally placed, so they're meant to rotate side to side. The facet joints in the spine are vertically aligned. So if you twist, again, this is a rod going through, but what you hear, you'll hear a clicking. And that's an exaggeration, but that's what's going to happen. Whereas if you turn your whole body, you're not going to get that clicking. So you're not going to get the irritation at that joint. When you're lifting, you want to keep your arms and the object close to your body. Remember, 10 pounds close to your body is 10 pounds going through your body. 10 pounds being held outside your body is 100 pounds of weight going through your body. You want to distribute the weight evenly to both sides of your body. Don't allow your knee to touch the floor when starting a lift. Do not lift any objects higher than your chest. You want to make it into a two-step process. Breathe as you lift. So we often think of if anyone's ever watched Olympic wrestling. Sometimes it's boring, but it's quite interesting to actually watch. It only happens every 4 years. So as they go to do an activity, you'll hear, and they're breathing as they lift out. They're engaging their core muscles to help support them. And you want to look forward, keeping your head up when you lift something, so that when you do start moving forward, You'll have a nice line of view. And if you think the object is too heavy, get some help to move it. You want to ensure when you're lifting, you're keeping your area free of obstacles, which is particularly important in the daycare environment. There's toys and obstacles everywhere. Shoes, Lego, anything. A child, they're stealthy and they kind of come up right behind you or right in front of you. Unless it's an emergency situation, if a child is kicking and screaming on the floor, but they're safe, leave them. That's not the time you want to get into. It's hard to maintain proper posture, proper biomechanics when you have a squirming, upset child with you. So put them in a safe environment, wait till they calm down, then you can bend down properly with knees bent, feet staggered, bring the child close to you and lift them up. You want to use both sides when you're carrying anything. We all tend to have that preference when we carry a child and we just start rocking them, and we always tend to go to one side and forget the other side. Ideally, you want to change sides often. So whether that's with a child, a purse, a backpack, it's really important. In the case of transfers of a more physically involved child, which we sometimes have in the daycares, and I've often been asked in these presentations about family members as well. Same principles occur when you're working with anyone. I would instruct you to follow the instructions of the healthcare provider or the physiotherapist who's working with the child. But again, oftentimes when you're lifting a child or transferring a child, we will ask people to sometimes use a specialized piece of equipment, a pivot disc that helps limit rotation for the provider. For the older population or even ourselves, when you're lifting them out of the chair, again, not just a full lift, have someone bend all the way forward and then have momentum kind of help push them up to standing. So instead of trying to lift them from the arms and pull them straight up, you're going to bend forward and then come up. Remembering keeping the object close to your body, whatever that object is, person, place, or thing. I guess you're not going to lift a place. And you want to keep a firm grip on the person. So sometimes we will use transfer belts or just a child's belt or just the child's top of their pants. So what we're seeing here, this lift is the ideal. You're bending down, back is maintaining the S-curves, your knees are nice and bent, staggered stance, the object's close to your body, and then you're gradually coming up to standing. You're using your legs, you're not using your back for lifting. But this is what often happens, right? You're doing something quickly, you just have something to bend over, you go to bend over. And so what we want to do is maintain the same curves back to the S-curve. As when you're lifting. So we're all really good. If we all go to lift a couch, we all get into the good position, the bending, we do the counting, 1, 2, 3, lift. But it's for everyday items and smaller stuff that we have to lift that we're not so good. And that's where we're going to run into issues, because those are the things we do repeatedly throughout the day. So these are the two positions you'd like to use. The most ideal would be the one on the left, okay? So the knees bent like we saw in the previous picture. But sometimes, realistically, we can't get down. Our knees are sore for whatever reason, arthritis, knee injuries, and so you can't get all the way to the squat, tight heel cords, whatever the reason is. So you start bending partially down and you can't complete it. So what you're gonna do is stick your bum out. So you've gone from a curved back to you stick your bum out and you've gone back into that S-curve. And that puts your muscles at the most supportive they can be within the body. Some other pictures we can see here are a standing desk, if you can, or even right now I'm just doing this talk at an adjustable tray and have my foot up on a little ledge. In this case, we have the standing desk and we have a foot up on a little stool, as you can see on the picture on the left. On the picture on the right, we're showing a demonstration of moving an item, a cube chair, which I'm sure you've all seen in the daycares, from one area to another. So you see that a wide stance of gait, feet are far apart, stagger slightly, and I'm not twisting my spine, I'm twisting my entire body. So you're not, actually, that was an incorrect choice of words, so I'm turning my body versus twisting my spine. If you're bending over, so this typically happens in a daycare, or in a home with young kids, you have to go to reach something and it always rolls right behind something, a couch, a desk, a counter. So you think, oh, I'll just be there a minute. So you go to bend and usually you're bending down with your knees straight and your back bent and then you get stuck. So this is the golfer's lift. So this is what they call it anyways, and what you need to do when you need to pick up an item that's stuck in something or behind something. So instead of using poor body mechanics to get there, the kids typically never roll it out in the open, a toy. It always lands behind a counter, behind a desk, behind the couch, and we think we're going to get something, so we kind of don't really focus on our positioning while we're going to lift it, and then inevitably it's stuck. And so we're tugging at it in that position, and then your eye catches something else that's fallen behind the desk, and so you're there a lot longer than you anticipate you're going to be. So what you want to do, the reason you just don't want to bend over and tug and you want to put your leg up, is you're maintaining the S-curves of your back during that time. Again, we live in the north. This is typical winter, and we don't want to get dirty. So we're trying to lift stuff out of our car. So whether it's salt, sand, snow, we're unloading the car, and we're usually jerking something towards us, not pushing it. And we'll talk about push and pull momentarily. But we really aren't using the best body mechanics. And also, as soon as we do this, that's typically after being in a car in flexion for a long period of time. So think unloading your car after a long trip. So the picture on the left, if you have to reach, either rest a knee on the car, in the trunk to get some support for your lower back and maintain those neutral curves. Some of the newer vehicles have lower trunks with the height lowered, so for ease of loading and unloading. But not too many of us are keen to have salt and snow all over us when we come somewhere. So if you want to stay clean, you want to try what we saw earlier with the lift of the box. So bending your knees and bending your back, and then again, sticking your bum out will get you to maintain that S-curve. It's not pretty, but it's functional, and more importantly, it's safe. So this is a typical pediatric environment. We use Teddy instead of a child due to privacy issues. So everything is child size in this environment. Go figure. So sometimes we have to be aware that we can't change the environment we work in. So we have to adapt using our back care principles. What we think will often be a short interaction with a child often extends into a longer period of time. So how do we adapt, right? You get asked questions and then their friend comes over and they engage you in conversation and then they want you to pick them up. So adapt during the day. Sit on a child's chair. Find a cube chair, sit on that. If you happen to have a rolling stool, great. But rolling stools in daycare environments are a little tougher because although they're great for posture and biomechanics, they're also great for kids to roll over other children's feet with and for them to get injured on. So they're not necessarily always available. You can also squat or sit on the floor versus bending over for an extended period of time. So when it comes to feeding some of the infants we're seeing, you want to keep your child close to your body. Make sure you rest your arm or pillow on an armrest. Ensure that your feet touch the ground and change sides. It's easy. If you're breastfeeding, you're forced to change sides. But with bottle feeding, either with your own child or the children you work with, we all, like I said earlier, we all have a tendency to always have a preference for one side. So make yourself change sides. It will be better for you and you won't be overusing one part of your body. So put them on the right for one day, the next day do the left side. If your feet don't touch the ground in sitting, and oftentimes it's hard when you're sitting on a chair in the middle of the daycare to come and get a footstool to put underneath your chair. Another little trick is to sit on your tuck your foot underneath your leg, your other leg, so it kind of looks like the letter 4. And so I used to get in trouble for this when I was growing up, as I wasn't sitting properly, according to my parents. But even at an early age, I was a physio in the making. So knowing that I was, in my head, I knew I had to adapt because I was never going to be able to touch the ground for a long time in my family with the chairs. I had to make do. So when carrying a child, you want to keep the child as close to you as possible. Again, keeping a firm grip on the child. Remember those issues: slippery clothing, sunscreen, water. And you want to watch for obstacles in your way. When you're lifting the child out of the car, you want to get as close to the child as possible. You want to place your knee on the seat or foot on the runner and maintain the natural curves as much as possible. We all know that when we're getting children in and out of cars, that's when they never want to go into the cars. And unfortunately, they don't want to go in the car seat and they're there for a long time. So you never realize prior to working with children or having your own children how resistant a 2-year-old can be or a 5-year-old can be, and they're not very much help when they're a complete limp noodle or stiff as a board. So you want to make sure on your side of things you're prepared as much as possible, because you have to be able to adapt to how they're going to react. Again, the issue is oftentimes if you have more than one child, it's great. You can have the car seat closest to the door. But does anyone know where the safest place is for the child in the car? It's in the middle of the back seat, which is always the least convenient for the parent, but the safest for the child. So again, really using those principles and getting yourself right into the car to place the child. And if they're in a good day, again, when the child can do it independently, let them do it independently. Get them to go in the car. If they can do it, don't lift them there. Have them do it themselves. But save yourselves for those challenging days. So picking a child up off the floor, you want to bend down to the level of the child. You want to bring the child as close to you as possible and then lift them up. And you want to make sure you use your legs and not your back. So what about the child that's running to you? They just came into daycare. They're so happy to see you. They haven't seen you all weekend. And they come running up to you, and then first thing you want to do is just pick them up, and even your child at home at the end of a long day of work, and they come in to see you, and you pick them up, you bend over with your knees straight, your back not properly used, no S curves, and you lift them up. And not only that, sometimes you throw them up in the air. So you've gone from one extreme of your range of motion, from the lengthened position to the shortened position. So all around, just not your back's at great risk of injuries. And so I just caution you, so that if they do come running up to you, and sometimes they get you and it's short notice, but if they do, get into that position, see them, they're coming, get your knees bent, get down to their level, bring them in close to you, and then lift them up. But you'll say, but they're so cute, Mary. Sometimes I can't help but lift them up. But if I said to you, here, take this 20 or 40 pound bag of potato, which are the kids you're working with, and I threw that at you all the time, and you would have no desire to take that and throw that up in the air and pick it up. So when you're lifting the child out of the bath, again, not rocket science here, but it's hard for us all to do. You want to use your knees, not your back. You want to ensure you have a firm grip on the child, and you want to bring the child as close to you as possible. Remembering, so when I say lifting out of the pool or out of a bath, or out of a sandbox, it's all the same sort of technique. And even lifting out of, they call them like baby gates now, or baby cages. Sometimes that's become more of the trend recently, even with kids who are around, lifting out of a playpen, lifting out of a crib. So same sort of techniques, as much as be safe as possible. And if you are lifting them out of a crib, make sure you lower the railing as low as you can go. Backpacks. Backpacks have permeated our lives. They used to be so uncool, and now they're all on fashion runways, and people are bringing them everywhere. So they're the best way to carry your computer, your lunch, your indoor shoes, your clothing, or other items. But what people aren't aware of, or should be aware of, is that backpack should not weigh more than 15% of your body weight, and 10 to 15% for kids. And if you've ever seen a kid's backpack, they weigh a ton, and often half of that stuff they don't even need, and they carry back and forth every day. So really want to be aware of that, because they're young and they're moldable bodies, and we want to keep them safe and healthy, their back safe and healthy. So ideally, you want to use both shoulder straps. It's a tough sell for some kids. So if we have to kind of compromise, have them use it on one shoulder one day, one shoulder the next. Just as I asked you to compromise when feeding the child from one side one day, one side the next. When you're putting items in the backpack, you want to put the heaviest items at the bottom. You want to pack by weight, not size. If you can, some of the backpacks now have hip belts or chest straps, and that distributes the load off the pelvis. You want to use padded, contoured shoulder and chest straps to help reduce pressure and balance the weight. A lot of backpacks also have rollers. If you can, use the rollers throughout the day. And ideally, the bottom of the pack should sit about 2 inches above your waist. And again, we're talking about backpacks, but purses are coming in backpack type styles as well. And purses often weigh more than backpacks. It amazes me how much my own purse weighs sometimes, and I don't notice it until someone goes to lift it and hand it to me, and they go, "What do you have in this thing?" So again, looking at backpacks, looking at purses, and even strategies for baby carriers. So realizing we're talking about distributing the weight evenly. So kind of going off backpacks a bit, but if you have multiples, twins, oftentimes you can carry one in the front and one in the back, and that will kind of balance the weight of things. Or if you're carrying a child, balance them one on each side. To push or pull? Answer, push. Why? It's easier and safer even if the object is on wheels. And the reasons are, you can see the path you're traveling, which is restricted when you're pulling. You're able to use both hands to push, while adopting neutral and safe arm and back postures to protect yourself from injury. Pulling puts you in an awkward position with the arm extended behind the body. This can lead to shoulder, back, neck, and arm pain while increasing your risk of injury. So again, what technique to use? We've discussed this already. You know it. You guys have this already. You want to maintain wide base of support with knees bent and engaging your core, so activation of those stomach and bum muscles. Back to the S curve of the spine, arms close to the body at 90-degree angle. And you want to push using smooth movements and not going too fast. If an item can be placed on wheels versus lifted to be moved over a distance, that's ideal. So even something like a golf cart used to always be, the best thing is walking, and you can carry that with a nice kind of backpack style. But it used to be that people were in carts. But if you're using a pull cart, and they used to have pull carts, now they have push carts. So instead of pulling it and going up and down hills, it's a push cart, and it's much more biomechanically appropriate. Prevention, more tips and tricks. For stretching, what are the benefits? Well, it increases flexibility, it improves the range of motion of your joints, it improves circulation, it promotes better posture, it can relieve your stress of your muscles, and it can also relieve some stress depending if you do it in a meditative way. It may help prevent injury, and it targets major muscle groups. More prevention tips and tricks. You want to remain as active as possible within pain limits with your daily activities, including work. Limit activities that cause pain to spread. Yoga, massage, meditation, mindfulness, etc. can help to decrease stress-related back problems. General physical conditioning, so regular aerobic exercise. A specific exercise program provided to mobilize and strengthen the spine and abdominal musculature provided by your healthcare provider can also be used. And the biggest tip I can give you is get in shape. So recent clinical studies indicate that the most important factor in avoiding back injury may be your general physical conditioning. This suggests that regular aerobic exercises, whether walking, swimming, or running, may provide the conditioning a back needs to stay healthy. A specific exercise program to mobilize and strengthen the spine can also be effective in preventing a recurrence of back pain. And going back to the types of yoga regarding stress relief of back pain, there have been studies on Vinyasa and Iyengar yoga. I'm not sure if I'm saying those properly, but those are where the studies have been shown to help with chronic pain. Hard work and exercise are not necessarily the same thing. We all work hard, but we are all not necessarily fit. Fitness levels remain decreased, and it's important that that is addressed, because that's certainly taken a hit over recent memory, and it's only anticipated to get worse with the invasion of technology in our lives. So more prevention tips and tricks. We want to maintain a healthy weight as it reduces strain on your back. Drink several glasses of water every day as it keeps you dehydrated and healthy. Recent clinical studies show a direct relationship between the development of lower back pain with smoking cigarettes and hypertension. And smoking also restricts circulation and slows down healing when an injury does occur. The next 4 problems are 4 scenarios that have been presented to me over the years while doing this presentation. And more importantly, there are issues that apply across the board. We can now take the knowledge gained today and apply to real-life situations. So the problem is your teenager's in grade 10, has recently started complaining of low back pain. They've been working really hard on school projects and reports. What are some contributing factors that could be affecting their pain? And what are some possible solutions? What I'd like you to do is, as you're watching this, perhaps pause the video and after each problem, take some time to discuss or just to to think about it. So one of the problems is often at that age, the child's undergoing a growth spurt and poor posture becomes exaggerated and becomes a reality in their life in all aspects of their positioning. They're sitting, they're laying down, they're working at an ill-fitting table, and oftentimes people don't have appropriate desks at home to work with. And even at school, the desks aren't ideal at school either. So you want to try to evaluate where they're spending their day, the majority of their day, and make their workstation more ergonomic. So if they're at home, trying to get them not to lie in bed, trying to get them to use a lumbar roll, even if it gets the backrest of their bed, if that's sort of halfway meet, or on a chair at a table in the house, kitchen table, the island, anywhere. If they do persist in wanting to stay in their room, a laptop tray sort of makes it kind of like meet them halfway. It's a fine balance with teenagers. And so we want something, it's better for something to be implemented than nothing to be implemented. So we have to work, it's like with a child, you have to offer choices, and then we try to offer them a mixture of choices. But you'll get better buy-in if they're participating. So frequency of flexion is another issue, right? Particularly with increased computer time and all aspects of life. They're sitting either on the bus, on the couch, or laying improperly in bed. So we want to get them to, like I mentioned earlier, a pseudo workstation, a standing workstation even at home. Sometimes you're sitting now, you've sat at your desk, you've sat on your bed, let's stand up for a bit. And a little trick is to encourage frequent changes of position. So wherever they are, and if they persist on wanting to stay in bed, timers typically don't work. If I say put a timer on your phone, they'll say, to heck with you, or worse. So what you want to do is make them seem like they're doing you a favor. So, can you please walk the dog? Can you, I'm stressed out. Can you walk with me? Or, have them go pick up, I forgot this downstairs. So have them run downstairs for you and pick up something. So it's best if you can sort of encourage them to move without saying, well, it's best, as Mary said, that every half hour you have to get up and change position. So that's not going to fly. You want to look at their backpack. Backpacks, again, as mentioned, should be more than 10 to 15% of their weight for elementary school kids and 15% for older kids. So we've talked about what to look for when we're doing the backpacks, and sometimes even for some of our children that I see at the Children's Treatment Center, we offer a second set of books at school. So, laptops are becoming more pervasive, but there's still some areas that they need certain books, so we'll try to have them keep a certain set at school and a certain set at home. Decreased fitness levels certainly decrease substantially as you head into the teenage years, and it's even worse for females. So studies have proven that females tend to be less active than males in the teenage years. So encourage as much activity as you want. If you're stuck at home, there's some great yoga or fitness classes out there online. Walks are great physical and mental breaks. It doesn't have to be an intense workout. It doesn't have to be a run. It can be something as simple as getting out in the fresh air. Weight gain. Oftentimes during puberty, there's a substantial weight gain. So make sure they're eating healthier food choices and better sleep. Often the child may have poor sleeping habits or postures. You want to encourage better sleep hygiene habits and use of body pillows. Smoking, vaping, we don't know what the child's doing. So again, promoting healthier lifestyles or smoking cessation courses for kids if needed. Footwear sometimes can be challenging with kids, especially the high heels you see the kids, or certain boots, or no support. And so postures will be affected from whatever way. If they have, shoes that are too large, high heels, that changes that plumb line, that changes those S curves. So just being aware. And oftentimes too, they don't have the great supportive soles on them. So you want to make sure that whatever they're wearing has a good grip so that they tend to be safe. Okay, problem number 2. You're 5'10", I wish, and 25 years old. I wish even more, and a recent graduate of the ECE program. You're thrilled to be working at a daycare, but have a long commute to and from work. After 6 months on the job, you start noticing some low back pain. The pain is particularly aggravated at nap time, when you're required to bend over the kids and rub their back. So again, what are some factors that contribute to their pain? And what are some possible solutions? So again, back to some problems. The height of the person and the work environment. In that situation, it can't be changed. So being aware of the body mechanics and adapting the best you can during the day. Getting down to the level of the kids. So this was a problem presented to me at the daycare. the worker's back was so sore. So I said, get down, like don't just, they were bending over them and rubbing their backs for sometimes a while before the child fell asleep. So I get down to their level. We were using kind of a little chair, like a little beach chair that they could sit on with a backrest, and then they would just rub the children's back, 2-for-1 special, while they were well supported. Your posture, no matter what height you are. Taller people have to look down and slouch and aren't aware of it, and vice versa. Sometimes the shorter people have to look up, extending their back, and again, that's not a great sort of alignment. So if you are talking with two people of substantially different heights, so a child and an adult, try to sit for longer conversations so that you minimize the height difference. And after you do get the kids to sleep and you've rubbed them nice and back on their cots, you can either get down on your hands and knees and crawl out between them, and then you can use your hands to stand up, or you can just stand up out of the chair. But again, frequent stretch breaks during the day. So if you have been sitting down, rubbing their backs, you get up to standing, make sure you stretch before you continue to move forward. Then the other problem with this situation is you have a long car ride. And that's the reality. I mean, wherever you live, sometimes you can't afford to live or just don't live close to work. So make sure you look at your sitting posture in the car. And when you have a new job, particularly a new job, there's just so much stress that goes along with it. So you're fatigued, you have less time for focusing on your fitness. So between the work schedule and home, and often that's called adulting, that you become an adult to start working for a living, there's lots of stress. So you tend to let fitness sort of go by the wayside. But it's really important to make time for exercise and sleep, because often proper exercise will help your sleep. And we don't know what the person weighs or if they're smoking. So again, just being aware of healthier choices. And frequency of flexion, that's a big thing. Again, we talk about everything that this person is doing throughout the day. So they're for the car ride, they're working in a pediatric environment. So again, adapting as possible. And again, trying to use appropriate footwear, supportive shoes with a good grip for the day and that are flat. That would be the most ideal. So number 3, you're a cook at a daycare or a large catering company who has been doing your job a number of years without problems. Lately, you have started complaining about back pain, especially by the end of the day. You're also a parent of 3 children involved in insert hockey, dancing, basketball, soccer, music lessons, etc. Again, looking at some factors that could affect their pain and what are some possible solutions. So we're looking at poor posture or prolonged standing at work. Again, standing for a long period of time. So it's hard, as with any of us. As soon as you stand in one position, good old gravity, which we can't get rid of, will take you down into more of a slouch position. So how do we correct that? Using a small stool like we saw at the standing desk, or place your foot on the edge, on the bottom cupboard ledge. So, or if you don't have that available to you, get a little stool that you can change the legs you put your foot on. Again, taking breaks during the day, just to give yourself a nice stretch back. Okay? You want to be aware of your body mechanics at work, including lifting heavy pots, the height of the countertops or person. They have to maybe lift heavy sport bags when they go home, musical instruments, maybe your child's playing the cello, and carrying your kids' stuff overall. Oftentimes they want you to carry everything and they just are going to walk out to the car. So how can we fix that? So you want to organize. In this particular case, it was a kitchen that they catered from the daycare, but they also provided meals to the children every day. And they had their setup, they had their working station over here and the counter at the far end. So they used to just be carrying all these heavy pots off the stove, but they were hot. So they were lifting them out here and they'd be moving them all the way across, right? So they're working poor posture, poor body mechanics, affecting the force loads, plus just the pure danger of spillage. So what we did, they had to transfer food across the kitchen. So we got them a cart with heat-resistant pad to travel between the stove and the countertop. And they went back and forth instead of lifting and carrying. Now, again, that's not always an option. So if they didn't have the cart with the heat-resistant pad, our other option would have been to have them put their food into smaller pots, keep it closer to your body. Again, 10 pounds equals 100 pounds if it's out there, but at least if it's in smaller containers, we try to do that with stretch breaks in between. And again, as we're working during the day at work, standing on a small stool. Regarding the kids and their bags, number 1, If your kids are old enough, get them to carry their own stuff. If they, and if they can't carry their bags, so have them at least carry the other stuff, their food or their coats or their jackets and all the other stuff. A lot of the bags come in rollers nowadays. So use them over the rollers, or use them if you have to put the strap over it, you can put the strap over both and carry it on your back, or at least switch sides during the day. So just an awareness. Okay, and there's some days you're just out the house pulling everything you can, and everyone's going to have those days and everything we do is wrong. But because we've done everything right on other days, we have that sort of extra reserve in our body. As far as the increased frequency of flexion, we saw that we're bending over the pots all day, cooking on the stove. When we go, we're sitting in the arena or the studio, or we're in the car driving them to where they need to go, or waiting for them, or we're bending over, lacing up their shoes or their skates. So how can we correct this? We want to, again, change positions for frequent stretch breaks. Walk around. So inside or outside, wherever you are. If there are stairs in the arena or in the dance studio or wherever you are, do them while waiting for your child. I mean, if your child's young enough and you have to be there with them the whole time, fine. But if not, just don't sit there on your phone or on your tablet. Try to get out moving and becoming active. And as far as fitness levels, we don't know the person's fitness levels, but keep them active. So if your kids are younger, you can get out and about walking or biking with them while you're taking them to activities. And if you are taking them to activities, then again, try to get some activity while you're there with the child. And again, particularly in this work environment, really want flat supportive shoes. We don't know what their footwear is like, but it's always going to be sort of that question of what it's like, and living habits. So again, just being aware how smoking, sleep patterns, sleep hygiene, positioning, obesity, all those things affect us, and what we can do to correct that. So last problem. You frequently drive out of town to do some power shopping. It's a day trip. That night upon your return, as you're ready for bed, you realize a household member has left some laundry on the floor. As you bend down to put it in the hamper, you feel a sharp pain in your back. Again, what could be affecting their low back pain, and what are some solutions? So everyone, we all know a lot of this is the same sort of thing. So it's different scenarios, sort of the same problems and some of the same solutions. So again, and particularly in this day, you've driven out of town, so that prolonged sitting. Frequency of flexion in the car, and then you get out of the car, and what do? Do you go for a walk? No, you usually go and eat food somewhere. So you're back to sitting down. So make time for stretch breaks. Frequently, whether a stretch break, sometimes that's forced upon us because we have to deal with our bladder issues, but if it's not, some people can't. So just get up and stretch while waiting. Poor posture. Watching your sitting position in the car. Make appropriate adjustments depending on the driver. So often if you're sharing the vehicle, do that. Again, don't just say, oh, I'm there, and then, if someone's really short and someone's really tall, you'll get a big difference. And I used to get heck from particularly my siblings, my brothers who are much taller than I am, that, they were gonna jam their knees up against the steering wheel when they got in. And that was back in the day of manual adjustments of the car. But I always said if I couldn't reach the brake pedal, and if I was fatigued while I was driving, I wouldn't be driving, being very aware. So again, watching your type of footwear, particularly when you tend to go on shopping trips or out of town, whether to a sporty event with events with friends or shopping. Sometimes fashion kind of overtakes function, and you're not as aware of that. So you want to look at your biomechanics when been out shopping. So we all have a preference for carrying our bags on one side. So we carry our bags, and usually more than one bag, 1, 2, 3. So plus our purse, plus a coat. And we all carry it on one side, and because we have to use our keys in this side, or wave to someone with this hand. So if you can, use a shopping cart while you're out and about. Distribute the weight between both hands. Make frequent trips to the car. So it's been a great shopping day. There's some things you just can't get online, so you have to go out sometimes. But take frequent trips to the car to lighten the load. Put them in the trunk and come back. Just make sure when you're putting them in the trunk, and particularly if it's a holiday or Christmas time, you let the person know who's waiting for your spot that you're heading back in and that they don't have a free parking spot coming up. So you want to look at your body mechanics of lifting. So make sure you use proper body mechanics. Whether it's loading the car, that's usually not as big of a deal because you're prepped, you're in healthy shape prior to leaving, you're all nice and refreshed. But after a long day of sitting and shopping and carrying heavy bags, your body mechanics tend to fail. So When you're unloading the car, make sure, again, putting your foot in, unloading it with maintaining that S-curve in your back. When you're unloading the car, whether it's from the trunk, oftentimes even on a daily basis, what happens is we're going to work and we put our purse or a backpack or everything else on the passenger seat. So instead of getting out of the car, walking around the car and taking them out of the passenger seat, we reach across and we're fighting with them. Sometimes they're bigger, trying to get them over to our side to get out. So again, that just puts at a higher risk of injury. When you're unloading the stuff from the car, make smaller trips in the house. We oftentimes will somehow one trip seems so much better than two trips. So we load up everything we can. Our hands, our arms are killing us. Our back is hunched and we get into the house and we're like, oh. But again, you're at risk of injury. If anything happened, you tripped on the stair, anything happened going in, you'll be at a risk of injury. So be healthy there. And then being aware, again, you've just sat flexed for a long time, depending on how long your car was. You've picked up, you've unloaded all these stuff. So you get into the house, and then sometimes, typically, when you tend to be gone at the house, who's ever in the house doesn't always leave it the way you want it to be left. So you go to pick up, even if it's something light as laundry. So remember back to my story about the pencil test, or back to the golf ball that Caddy left, right? You pick up a piece, a sock or a pair of pants or anything it is on the floor, and you bend down wrong, and all of a sudden it's like, it was, and then you're like, it was your sock that caused my back injury, but really it wasn't your sock that caused the back injury. Okay, so that kind of was the straw that broke the camel's back. So if particularly after a long day, your muscles aren't working as efficiently, you're very fatigued, remember that golfer's lift, bend down properly and put it in. But the ideal thing to do in this case, the solution would be in this case, is to have the person who dropped the laundry pick it up for you, and then you wouldn't have to do anything. So in summary, almost everyone experiences some type of back pain at some point in time. The pain may occur suddenly and be gone within a couple of days or weeks, or it may occur repeatedly, never going completely away, and can have a major impact on your regular daily activities. Education and prevention are key, as the majority of back injuries are the cumulative result of our lifestyle, environment, and physical condition. They cannot be managed effectively unless these factors are recognized and dealt with. If you do have persistent back pain, please seek the advice of a healthcare professional. Remember, you only have one back. Treat it well. This is my favorite slide. So it shows you she's happy, she's healthy, and she's maintaining her flexibility, and she's out for a walk in the day no matter what age.